Good evening, St. Lucia, and once again, welcome back to the Information Command Center for St. Lucia's response to COVID-19 on the National Television Network. On a daily basis, we have been keeping you updated along with our partner stations on information coming to hand on our country's fight against COVID-19. As we all understand by now, this is a very dynamic situation, and we continue on a daily and sometimes even hourly basis to look at what is happening and analyze what is the appropriate government action and response. Hence, these regular updates from government officials as well as key persons involved in the COVID-19 response. This evening, we are speaking specifically to the 24-hour curfew and measures put in place for Monday, April 6th and the week moving forward. In studio this evening is Prime Minister Honorable Alan Chastanet and Chief Medical Officer Dr. Sharon Belmar-George. We begin with Dr. Belmar to provide an overview of the situation to date. Dr. Belmar.
Thank you, Ms. McDonald. Good evening. Over the past 5 days, every citizen was engaged in a very aggressive public health effort to contain the potential spread of COVID-19. The COVID-19 virus is easily spread, particularly when people gather in group settings, be it at work or in neighborhoods or in our usual social and recreational activities where we tend to gather. Due to the recent establishment of in-country transmission and the risks associated with this rapid spread, there was need for urgent and decisive action to protect the health and life of every citizen. As such, the instituting of a 24-hour national curfew was a necessary action to restrict the movement of every individual for the period April 1st to the 7th, 2020. By complying with this requirement, the expectation is that there is significantly less spread of COVID-19 virus. Though unprecedented and seemingly extreme to some, this intervention is being undertaken in the interest of health and protection of the life of our citizens. Across the region, a number of our sister islands have adopted similar measures as we as a region collectively recognize the potential threat of COVID-19 that it can pose to our people, the most precious resource in our part of the world. Important to the success of the national curfew, which commenced April 1st, has been the support of each and every individual. Every measure undertaken to respond to COVID-19 and to reduce its impact cannot be done successfully only by state agencies, not only by the Ministry of Health, not only by the law enforcement, and not only by the policymakers of our country. Rather, the involvement of our citizens in protecting and preserving our nation's health and those that are most at risk. By complying to the requirements to remain at home and having significantly less or even no social engagements, the likelihood of containing the virus improves significantly. This, by extension, places less pressure on the health system to undertake contact tracing, testing, as well as treatment and care of confirmed cases. The period of shutdown has provided the Ministry of Health with a needed window of time to undertake intense and concentrated efforts on contact tracing associated with our confirmed cases currently in care. To date, we have a total of 14 confirmed cases of COVID-19. 2 of them have been repatriated to the UK. All of our cases remain clinically stable and are doing well. We have had 0 COVID-19 deaths to date. In addition, with the restricted movement of people, we recognize that the potential spread of the virus by suspect cases who would have otherwise been engaged in their routine activities would have been reduced. This also served as an opportunity for containing further spread of the virus. As St. Lucia commences the gradual scale-up of activities and the daily movements begin to increase, we request due attention to be paid to the recommended guidelines to reduce the spread of the virus. Avoid social gatherings. Maintain the 6-foot distance when engaging in activities in public. Ensure adherence to infection prevention and control habits, which includes regular and routine hand washing and cough etiquette. We ask that only the necessary movement and social interactions be undertaken as we continue to maintain behaviors which reduce the risk of exposure to the virus. COVID-19 is an unprecedented public health emergency situation. And like other countries regionally and globally, we in St. Lucia, we're working hard to respond aggressively to keep its impact to the most minimal level possible. Together with a focus on achieving this objective, we can have the collective force needed to protect the health and preserve the lives of our people.
Thank you, Dr. Belmar. I now invite Prime Minister Chastanet to update us on measures in place for Monday, April 6th, and for the rest of the week in St. Lucia.
Thank you very much, Nicole, and thank you, Madam CMO. My fellow St. Lucians, before I begin my intervention tonight, I would hope that all of us would join in wishing commiseration and prayers for the Smith family in Saltibus. As many of you may have heard, Rez Smith, who was a 7-year-old boy, drowned of a suspected, or had a suspected drowning in Saltibus. And I actually know the Smith family, and I just want to, on behalf of myself, my cabinet, and the nation, to express our condolences to you, and I wish you all the best in these very difficult times. I think it's important that I put us in the frame of mind and the context of how we're making decisions. I hear many people trying to question this policy or that policy and to understand what is it we're attempting to be able to do, and the government's strategy along with the Ministry of Health strategy in combating COVID. What we've seen recently is that we have 14 cases. That's what we've been able to confirm. And when we compare ourselves to other countries, that on a per capita basis, the number of testings that we have done are not overly high, but are also not at the bottom. But I would have to say to you, I think the CMO and myself and Cabinet don't believe it's sufficient for us to be able to have a very detailed understanding as to what the level of the spread in our community was. We have had a strategy from the get-go to be able to delay COVID from coming to St. Lucia and impacting our population. Why? Because when it originally broke out, we were honest with ourselves, and we knew that if we in fact had a community outbreak, we would not be ready. Victoria Hospital by itself, trying to serve both the general patients and also COVID patients, would be virtually impossible. And so the decision was made to be able to advance the move into OKU. And while OKU wasn't 100% ready, relative to the risk of staying at Victoria Hospital, that certainly made the decision much easier. And it was made even more difficult by the fact that the Martinicans and also the consultants that we'd hired were not available to us here to assist in the move. And I really want to thank all of the line staff, the nurses, the doctors, and the private sector GPs, everyone who came together to be able to facilitate that. So again, thank you to the Director of Hospitals, thank you to the Minister in particular, the doctors from Tapion, the general practitioners around St. Lucia, all the nurses that came up from the primary healthcare services to be able to help facilitate this move that went very well, and we're now fully operational at OKEU. We've now been working, and I believe by Monday, we're ready to operationalize Victoria Hospital as a respiratory hospital. As you know, this weekend, the persons who were in administrative quarantine at Starfish and also at Belmar-George have now left for the most part. I believe there's only a handful of persons that are still in quarantine in those operations. So it means that we now can convert Starfish into an isolation center, and we have Belmar-George standing by if in fact we need more beds to be able to host and to handle people. But before even getting there, my fellow Solutions, the difficulty that we had is when we reached the point where we saw in 1 week an increase of almost 5 cases, that we became a bit more concerned. And certainly one of the things that was required of the CMO and her staff was to do contact tracing, to immediately find out who those individuals were in contact with and determine whether in fact that they were exposed. That contact tracing generated 100 people that either had to go into self-quarantine or administrative quarantine. And we quickly started to realize that if we had more outbreaks, the idea of putting people into supervised quarantining, that it wouldn't work. That it wouldn't be that we didn't have enough beds, we certainly would not have enough staff to be able to do that. And so the decision was made to put every single St. Lucian into compulsory quarantining. And I'm not so sure that everybody really has understood or come to grips with that concept. As the CMO indicated tonight, what we had to do was to restrict the contact of individuals with other people, because we know that that's how the virus spreads. And we felt at that time, because we could not ascertain for sure how many people in the community had it and who had it, if in fact we were testing widely, it means we would be able to identify those St. Lucians that had corona. And we would have been able to isolate them in order to be able to limit the ability of it being spread. But in the absence of knowing for sure, the decision was to put every single St. Lucian into quarantine. And the curfew was simply a mechanism to make that happen. Because we had learned by past experiences that we could not, sadly, trust people to self-quarantine. There are many examples that you know in your own neighborhoods of people who were supposed to be at their home in quarantine and feel they can go to the grocery store or they can walk around the neighborhood and didn't truly understand the threat that they were to their own family members as well as to their own neighbors, and particularly to people in our society who are vulnerable. And let me remind you, the diabetics, the people of hypertension, anybody with asthma or any form of respiratory disease, an elderly person, all these people in our society, these are the most vulnerable to the virus. And so because we could not trust people, and it would be irresponsible as me as your Prime Minister, with the responsibility of protecting all St. Lucians, to have just accepted that we would have taken the chance of self-quarantining. So the curfew was required to be able to do that level of enforcement. Now, a 24-hour curfew comes with another dilemma. And that dilemma is that people need substance to survive. And we know the economic plight of many St. Lucians. My cabinet and myself were never naive to that fact. We know how people are struggling. So the question is, how do you balance between people needing food substance and then people protecting their health against COVID? So in an ideal world, for 100% protection of COVID, we would continue to have everybody in a 24-hour a quarantine at their home. But we know that that's not realistic. But as the CMO has indicated, this past week has given the Ministry of Health the opportunity to get themselves organized and to have a better assessment. Now, not 100% accurate, but a better assessment of where we're going. So on the basis of that, and in the discussions with the CMO, and discussions with the command center that we have, and discussions with a wide range of business people in St. Lucia, we've decided that we could now reduce the 24-hour curfew. But what we're going to do is we're going to maintain that curfew until Tuesday morning at 5. So tomorrow, what we're going to do is the 24-hour curfew will remain in effect, and we're going to allow the bakers will be able to open and provide delivery service of bread only. That means that they can bake their bread, but persons are not allowed to go to their shops to buy the bread. And the bakeries will be providing some form of delivery for bread. We're also going to allow the supermarkets, the mini-marts, distribution of food items, gas stations, cooking gas, allowed to operate only to restore their shelves. So let me say that. It's only the persons working in those companies that will be able to come out tomorrow in order to be able to stock up and get prepared for the rest of the week. No minibus or transport will operate except for essential services and the supply of restocking of food industry. So again, the buses, and they know who they are bringing all of the essential service providers, the nurses, the police officers, everyone else, to work. And that's what's been going on during the 24-hour curfew. We've also decided that we will continue to prohibit the sale of alcohol. So that's what's going to happen on Monday. On Tuesday, we've decided to go back to our SI 44. So those who can find our SI and it's number 44, these are the services that we're now going to basically open. So in essence, what we're going to do is we're going to reduce the curfew from a 24-hour curfew to a 10-hour curfew, which will be from 7 p.m. to 5 a.m. So that's going to start 5 a.m. on Tuesday morning, all the way through to Easter Monday. We're going to allow all services provided in S44, SI 44. So basically, we'll allow the services to operate on Tuesday, Wednesday, Thursday, and Saturday. Sorry, Tuesday, Wednesday, Thursday, and Saturday, yes. We'll be able to operate from 7 to 4 p.m. They will be closed on Friday, which is Good Friday, and will also be closed on Sunday, which is Easter Sunday. So next week, Monday, tomorrow, we're still going to have the 24-hour curfew in effect, except for the persons who are working at the grocery stores, at the wholesale stores, at the bakeries, persons who are in charge of filling up LPG cylinders, persons who are working at the gas stations. All of these people will be allowed to break the curfew tomorrow in order to start preparing the country to be able to reduce the 24-hour curfew to a 10-hour curfew, which will be from Tuesday, Wednesday, Thursday, and on Friday we'll have a holiday, a Good Friday, and then we will have back on Saturday, and then we will have Easter Sunday as being a day off. While we're in that 10-hour curfew, the public are encouraged that customers will only be 2 per family to shop within their own communities. The country will be zoned, and we will provide greater detail tomorrow on where those zones are and what you're expected to do to remain in your zone. Only 2 people will be allowed to be in a private vehicle at any one time. I would like to say to you that the police will be monitoring and enforcing the zoning. And one of the things that they'll be using is they'll be using road checks and checking your driver's license to ensure that you're remaining in the zone that you are residing in. The police will be patrolling when supermarkets are reopened to ensure compliance of the COVID-19 and the social distancing health protocols. So again, the police will be working with the business community to make sure that there will be strict enforcement of these protocols. And again, tomorrow, we're expecting that the business houses, the banks, and the supermarkets that will be opening up will be putting marks on the sidewalks and also internally systems in order to make sure that the social distancing is going to be enforced strictly. We're also going to continue to prohibit the sale of alcohol everywhere, including at the supermarkets, the grocery stores, and at the gas stations. And the supermarkets will to commence restocking from Monday, as I indicated, April 6th. So tomorrow, the government will actually be on a blitz using NTN and all the other media houses to be able to provide even more details in terms of how this is going to operate. So again, I'm very pleased to be able to say to you that with the discussions of the CMO, that we're substantially confident that we could now reduce the 24-hour curfew and go to a 10-hour curfew. But I'm appealing to all St. Lucians to continue to understand that you are still in a quarantine, and that when you leave your home, you are to act and conduct yourselves as if you are in a quarantine. And the safest advice that I've heard from anyone is to pretend and assume that every single person that you're coming into contact with, that they have corona. And I want to ask you to ask yourselves, when you leave the safety of your house from the quarantining, why would you want to go out and expose yourself unnecessarily and then bring back the virus to your own family members? So I'm appealing to all of us, despite how anxious you may be to purchase anything, it's not worth your life. It's not worth anybody in your family's life. So please, continue to practice the protocols that the health ministry has is imparted to you. Let us be responsible people. Let us show that we can make this happen. And again, for those people who are more vulnerable in our society, people who have less income and therefore are not in a position to stock up in order to be in a 24-hour quarantine for 7 days. Let's make it possible for them to stay out, and at the same time to allow our country and for all of us to remain safe.
Thank you very much, Prime Minister Chastanet. Just to reiterate what the Prime Minister has just announced, on Monday, 6th April, that is tomorrow, only bakers will be allowed to do delivery of their baking items. All mini-mart, supermarkets, food items, gas stations, etc. are only supposed to restock tomorrow. So tomorrow, Monday, April 6th, is a restocking day for our country. As of Tuesday the 7th from 5 a.m., the country will reopen on a scaled-down basis for essential services. Those essential services are available on the Government of St. Lucia website. In SI 44, there is a full list of all essential services that are allowed to operate in the scale-down approach by the Government of St. Lucia. I now turn to the CMO to just explain to us what would be some of the protocols that would be in place at the supermarkets and with our food suppliers. I know there have been extensive discussions over the last few weeks in terms of protecting, reducing the spread of COVID-19 by the way we operate our supermarkets and social distancing measures. Dr. Belmar?
Thank you. The supermarkets, food suppliers, and retailers, in consultation and collaboration with the Ministry of Health and Wellness, will ensure adequate measures are in place to facilitate reopening to reduce the spread of COVID-19. Some of the shopping measures include, and are not limited to those, limit the number of customers inside the store to ensure adequate social distancing. Ensure every customer entering the store has a face mask and sanitized hands. Manage the queuing of customers outside of the store to ensure safe distancing, no less than 6 feet. They will have internal controls to avoid hoarding of items. Ensure adequate systems and resources to move customers in an efficient manner. Distributors will work closely with local community stores island-wide to ensure adequate supply of goods. Distributors and retailers to encourage and facilitate online and direct delivery providers and shoppers. The enforcement of stricter protocols governing the use of transport carrying supermarket and essential services. The increased intensity of cleaning protocols for retailers. Also, to limit the sale of chilled, on-site prepared, chilled ready-to-eat products such as cut fruits and salads. As part of our national protocols, we continue to advise the public to stay at home. Only leave for essential purposes, such as medical emergencies. Avoid mass crowd events and social gatherings. Although we've opened up a bit, mass gatherings are still banned. Practice social or physical distancing, that is, remain 6 feet from the closest person. Practice good hygiene, such as frequent hand washing. Avoid touching your eyes, your nose, your mouth. Cover your cough and sneeze with tissue. Wear a face mask or scarf when going in public areas. Adhere to the curfew in effect. We also continue to remind the public of our clinical telephone numbers that are available. These have been shared with the public. If you don't feel well, please call one of those numbers for medical, clinical advice. Also, for general information, to call the COVID hotline at 311. It is extremely important that the public adhere to these guidelines. I also want to acknowledge our healthcare workers who continue to put their lives and the lives of their families at risk. They manage patients in our respiratory clinics in the community and also at the respiratory hospital. Also, apart from our physicians, our nurses and other workers in those institutions, our fire service, our police officers, all of those workers continue to put their lives at risk when they manage patients. So take this in mind and please stay at home and adhere to the guidelines and the protocols that we continue to put in place.
Thank you very much, Dr. Belmar. I was hoping you would also speak to our ability to continue testing. There have been some reports that we are facing some challenges when it comes to testing. Can you speak to that, please?
Yes, well, we have developed national capacity to test for COVID-19 at the Ezra Long Laboratory at the OKEU Hospital. Globally, there is a shortage of the reagent, and St. Lucia, just as all of the other islands in the region, we are faced with the increased time of receiving those reagents. However, we continue to work with the Caribbean Public Health Agency, so whenever we run out of reagent, they work as a plan B so that we do not stop testing. We have continued testing this week through the Caribbean Public Health Agency, and we anticipate that by early next week, we will continue testing within our own national lab.
I know you addressed the issue already, but I think it's worth repeating. There were some reports that we had a death from COVID-19. Would you just speak to that once again so St. Lucians know what the facts are?
Yes, as we indicated, I think yesterday, we have a total of 14 COVID-19 cases, confirmed cases in St. Lucia. And to date, all of our patients are clinically stable. None of them have complicated, and we have no deaths. We have 0 deaths of COVID-19.
Thank you very much, Dr. Belmar. Prime Minister Chastanet, as we close, if you could just speak to the rationale for the decision, just briefly, behind moving the curfew up one day and opening up on Tuesday.
So on Friday, after we had reviewed the experience on Thursday and waiting for the input from the CMO's office, and as you know, we had several people being tested, and so we decided that we would wait to make any final decisions until we saw the results of some of those tests. As you know, one person came up positive on the test. I'm very happy to report that the system that the CMO had put in, this is one of the persons that was identified through the contact tracing and had traveled down with a person from New York and had been in, I believe it's self-quarantining, which she was under isolation. So therefore, we knew that she had not spread it any further. Certainly in looking at our respiratory hospitals, we've not seen any substantial increase in patients coming in. We've also been continuing to try to find the appropriate protocol for the logistics of being able to feed everyone. As you know, we've gone through the care packages, and I want to repeat. The care packages were intended to be for the persons on the poverty list, as well as the persons who are waiting on standby for the poverty list. And that list was expanded to include other groups as well as other NGOs. The supplies that we were putting into the constituencies and the phone call number, the numbers that we gave for people to call, was people who had an emergency. And this is why we made the reference to the constituency. So on the constituency branches are the town council, the emergency grouping, as well as the welfare officer. And we believe that that group is more than capable of filtering the phone calls to determine who the real needy are. And I want to say there are many people who need, but there are some people that were in a dire situation. We know that the persons who are on the poverty list are not earning enough money or getting enough money to be able to fend for themselves. And we felt as a caring society, we had to take care of them. Now, I will provide a report tomorrow night on all the things that happened, some good and not so good. But I can tell you what the intention of what we were attempting to be able to do with regards to the care packages. But the care packages in themselves are not going to solve the problem of closing down the grocery stores for this length. We also had a situation in which the banks have been closed for over a week. So again, if you start working backwards and you want to be able to people to eat, they have to have money. And all of a sudden now, in addition to opening up the grocery stores, you have to open up the banks. And then there are all the supporting services that have to go in play to make all those things happen. So once you decide that you're going to open up the grocery stores and the banks and being able to provide gas cylinders, it's going to create a certain amount of increased activity. It is that activity that puts us all at risk. And so therefore we feel a little bit more comfortable of expanding the level of activity, but in a very controlled way. So this is why we're really appealing to St. Lucians to please recognize that you are still in quarantine. And we're trying to create a scenario in which we can keep you protected and at the same time allow for people to be able to get food and for people to be able to go to the different financial institutions to cash their paychecks and to be able to get some cash to be able to buy the groceries. So this is the thinking behind what we're attempting to be able to do. This week is going to be a very big test in terms of whether these new protocols of creating a zone, limiting where people are going, because we don't want people liming. As the CMO said, you're supposed to stay home. You're only supposed to come out if you need to get groceries and go straight home. And if you have to go for emergency services. And I want to make this last appeal to you on a couple of counts. CMO spoke about all of the persons on the front line. When we disobey and we expose ourselves, we are exposing other people unnecessarily. It's unfair to them. My heart goes out every day when I hear about doctors and nurses, attendants, caretakers who have died, who've been on that front line. I mean, this virus is affecting everyone. The other thing is if in fact we increase our interaction with each other excessively, and we now have a major community outbreak, as well prepared as we are, we still are limited. Because as I've indicated to you, we only have X number of nurses, X number of doctors, and X number of equipment. And so therefore, if in fact we allow this virus to take off and it starts to peak very steeply, what it's going to do is going to force people to make decisions as to who's going to live and who's going to die. And I'm asking, I certainly don't want to be in that position. I would not want to put my doctors and nurses in that position. So I'm appealing to all of us. This is a difficult virus to understand because we cannot see it. And because it has not broken out as badly as it has in other countries, does not mean that it doesn't remain dangerous. So I'm appealing to all St. Lucians to adhere to these new guidelines. This is not a sense of freedom and permission to go out and restart your lives as they were pre the 24-hour curfew, but certainly a responsible way of being able to serve the needs of everyone.
Thank you very much, Prime Minister Chastanet. Thank you very much, CMO. I just want to recap the decisions that were announced today so everybody fully understands. St. Lucia is still on curfew tomorrow, Monday, 6th April. Only bakers will be open to provide delivery service. Supermarkets, mini-marts, distributors of food items will only be allowed to restock. So tomorrow is a restocking day, as I said before, for our country. On Tuesday, April 7th, Wednesday 8th, Thursday 9th, and Saturday, services will be offered in terms of essential services, which is listed in SI 44, which is available on the Government of St. Lucia Facebook page and obviously on the Office of the Prime Minister page. We will be providing a summary of everything which was said this evening in terms of decisions on the Office of the Prime Minister page and on the Government of St. Lucia page. I would also like to thank all our partner stations who are simultaneously broadcasting with us this evening. As the Prime Minister did say, stay tuned to NTN and all the stations. We will be providing details on zoning, how it will operate, and some of the other issues which need further details this evening. I think the Prime Minister wanted to say something further.
Yeah, Nicole, I just wanted basically to expand a little bit on what you said, because I don't want to give it the impression that tomorrow is only going to be the bakers and only going to be the wholesalers and grocery stores. The banks are also going to be mobilizing tomorrow to replenish the ATM machines and prepare themselves for operations on Tuesday. The manufacturers who are producing food items, the brewery, the water, all these companies are also going to be mobilizing tomorrow and to prepare to be able to provide the products for Tuesday, Wednesday, Thursday, and Saturday, because we're going to be open for at least 10 hours during those days. So we want to make sure that there's a production in play before we open up on Tuesday.
Okay, so this is not for regular St. Lucians to go out
Right.
and rush to do
And
anything.
again, you know, our fisher folk and our farmer. The fisher folk, I'm saying to you, the Minister of Agriculture is in discussions with the Commissioner of Police and the Marine Police to see what protocols will be in place for them to hopefully be able to go back out. But again, you know, we need to make sure we preserve our borders. And the other one is that under the 24-hour curfew, farmers needed to be able to get a pass from their extension officers to be able to go out. As of Tuesday, they will be able to go out because they're part of the SI 44. So you will not need, and they can go out to be able to sell their products and to be able to distribute their products around the island.
Yeah, just to let St. Lucians know, when we refer to SI 44, we are referring to the essential services list. It's just a technical term for the essential services list, which is available on the Government Information Service website, and I'm sure all our partner stations have it as well. They would be referring to it tomorrow to let you know what those essential services are. I want to thank the Honorable Prime Minister. I want to continue to thank the CMO and her team for their excellent work. We're behind you, we're with you, those on the front lines. We really do appreciate everything that's being done to help St. Lucia. Thank you for tuning in, everyone. Join GIS in the morning for further updates on what's happening. I do have to mention our partner stations just because they're so important to the effort. DBS, HTS, Choice TV, The Wave, WeVent, MBC, Calabash TV, Radio Caribbean, Vibe Radio, Hot 7 TV, Hot FM, Rhythm FM, Blazing FM, Kiss FM, GVT, and Underground TV. Without you, we would not be able to get this message out to every St. Lucian. Stay tuned for the Creole update of everything we discussed this evening. Thank you for joining us.
Personal risk reduction is important. Germs are everywhere, and you can reduce your risk of infection by practicing some basic infection control measures. Taking the stairs, avoid touching the railing. If taking the elevator, ensure you use hand sanitizer immediately after exiting the elevator. Hand sanitizers with 60% or more alcohol are great to use, so have some readily available on your desk for quick use. Have your own personal bottle to carry with you when away from running water and soap. Germs can spread easily and be anywhere. Be sure to wipe down or disinfect desks, telephones, and keyboards. Washing your hands often will reduce the spread of germs, but you must wash them as recommended. Masks and gloves serve a purpose and provide protection when used in the recommended settings and when used correctly. They are not practical for the office or business place and can lead to the further spread of germs when used badly. Use only if you are coughing and or sneezing or taking care of someone who is ill with flu-like symptoms. For more information, call the Ministry of Health and Wellness at 468-5347, 468-5349, or 468-5350.
Bonsoir encore, merci pour vous écouter nous sur NTN GIS et sur station radio n'importe ça vous écouter. Qu'on a bien savent Premier ministre l'a adressé nous et puis CMO chef medical officier Dr. Belmar-George et puis là nous avons un chay information qui moi kay essayer distribuer ba ou une explanation là il vini pour ça en créole. Premièrement, on a commencé puis ça CMO ça c'est Dr. Belmar-George j'ai touché à ça là il vini pour verminza COVID-19 là où kay savent là il vini pour verminza nous trouver nous la kay nous puis il a trouvé koy fermé en chay de nous qu'on la vie en chay de nous changer là dans raison d'elle c'est ça si moi t'es ka bonne explanation pour en parmi bagay parler dit c'est là vini pour vermin il fait nous comprendre dat qui là présent les nous venons ensemble nous assembler nous parmi yon à l'autre nous ka exposer qu'on nous pour vermin ça qui en communauté et ben côté au pays en parmi moun en parmi yon à l'autre ou ka exposer corps quoi pour raison ça ou kay savent nous te ka mette yon à l'autre en wis hen vermin quoi pour raison ça ou kay bien savent Premier ministre là et puis cabinet teni pour point en décision pour dire nous où était kay nous enfin fermer pays pour 24 mois de temps et nous teni ces gens qui travaillent en essential service qu'on nous accueille yo doit là ka assister quoi là messieurs dames nous te fermé pour les 1er avril pour les 7 et ça bail pays ça bail santé ministre santé il baille une chance pour travailler avec mettre un chay bagay en place. Là, il te baille une chance pour examiner ça qu'a fait là et pour yo même faire tout connaissez yo peut faire pour ça qu'a là il vini pour manière 20 minutes qu'a trouvé koy transmitter et là yo teni pour prendre en considération protection pep Saint-Lucie là il vini pour situation ça. Là aussi, il a adressé à sous ça qui j'ai fait par du temps, il a qu'à espérer et examiner situation nous te en dedans. Et puis il dit comme ça, si un mois dit comme si c'est ça qui t'est fait là, qui c'est fermé pays pour 24 années de temps ça, les premiers pour les 6 ça nous trouver c'est il partait yon info santé tout seul. Ça pas été un info gouvernement tout seul, mais c'était un info tout le monde. Ça fait moun wete kayo, ça fait moun payer attention pour avertissement qui te bail, tout le monde vient ensemble et qui a dit c'est ça qui aide situation nous jodia et mettez-nous dans première position. Ça pas veut dire toute bagaille déjà passé. Non, il mettez-nous dans première position. Là là, il vient pour le département de santé, bagay travail avec marché primaire et puis yo a une chance pour organiser quoi yo là en l'hôpital là ça c'est VH et vous ils savent l'autre hôpital là en opération qui c'est OK IUA ça trouvé quoi en opération aussi et là présent il ça rapporté date qui là venu pour Sainte-Lucie nous pas seul pays qui mettait ces arrangements ça et point précaution c'est les autres pays a fait même bagay là et puis yo suivent nous. Là, autant Premier ministre là, après adresser qui ça qui a fait. Et si moi aller pour bailler explanation pour dire nous, même si bagay yo kay ban nous anti chance. Et moi kay vinn en détail qui sa chance là et qui manière nous kay opérer 24 heures de temps yo ban nous anti soulagement. Mais ça y a dit nous voulons moun payer attention pour ça ou supposé faire toujours. Et quand parmi ces bagages ça nous a parlé à vini pour faire maintenant et pour empêcher ici mais nous a dit moun pas supposé aller combler et venir ensemble avec yon a l'autre à comme si dit rien pas fait. Nous voulons moun était 6 pieds haut yon a l'autre. Il aller plus vite pour dire la pas supposé ni moun ka ensemble pour pièce raison yon et ben l'autre. Si c'est pas un état de sous-coup, sou pas obligé à faire ça ou ni pour faire. Quoi yo ka mande moun souple pour qu'on change manière ou ka agir puis on a l'autre fait à comme si dit chaque monde ou ni vermine COVID-19 et ben il aussi aller enfin pour dire déjà nous ni 14 cas là vini pour COVID là qui dit c'est moun nan ka comporter ko yo bien yo pas ni personne qui jamais bail explanation pour ça et puis là mais c'est nous bien content qui dit qu'on tous les autres pays yo ka travail bien wed faire assurer toute bagaille en place et pour faire assurer nous pas aller plus loin ben plus monde ka contacter vermine COVID-19. Bon, là il venu pour nous qui te espérer pour un pays ouvert bagaille vini en titak primaire mais mi c'est comme ça ikaya. Demain, lundi, le 6 avril, yo ka ouvert, mais c'est bakery, c'est yo qui ka ouvert pour yo délivrer pain yo et marchandises yo, by c'est plus grand place là. Yo ka ouvert pour faire délivrer. Et là, Premier ministre là parlait qui dit comme ça, place là ka ouvert, mais c'est pour un petit soulagement. Ça ka bay place qu'on supermarket. Ça ka bay cette boutique là. Ça ka bay moun qui ka distribuer marchandises en chance pour mener ces bagages ça en ces différentes boutiques, supermarket et puis ces différentes places là. Là il vini pour gas station. C'est moun ça qui fait assurer yo ni assez gas, yo ni gaz pour machine et puis gaz pour moun tuit manger. Là demain lundi place là qui ouvert pour tout le monde ça mettait acheter marchandises en dedans boutique yo en dedans ces supermarket là et puis c'est moun qui ka produit pour yo ça distribuer ça yo besoin faire aussi c'est banque là yo ka ouvert mais banque ka ouvert pour faire assurer ATM avec machine qui ka servir la hani assez là et pour yo mettre bagay en place quoi encore moi ka vie répéter pays a kay ouvert mais il kay ouvert pour ces gens bakery pour yo faire délivrer il kay ouvert pour ces supermarchés à vieux mettre bagay sur les tables yo il kay ouvert pour moun qui besoin mettre pli manger en boutique pour gas station c'est moun ça fait assurer yo ni assez gas et puis là pour faire assurer nous ni assez bagay en ces différents places là comme halon maintenant la pakay minibus à sous chimère except c'est minibus là qui a transporté police, nurse, docteur, ça nous a créé service essentiel. Et c'est moun sa jala et yo ha connaître koumoun yo ye. Aussi, c'est moun nan qui kay bay manger, c'est moun nan qui kay travailler en ces places là, qui a préparé pour ouvrir plus tard en semaine nan. Là aussi information c'est pièce wom pa kay vendre, pièce côté, pièce boutique, pièce restaurant, pièce côté pas supposé ka vendre wom. Là il vini pour mardi, mercredi et puis jeudi. Ou kay savent vendredi c'est vendredi saint et puis là ou kay savent dimanche c'est Pâques. Quoi ça c'est un holiday mais là il vini pour lundi, mardi et puis jeudi. Là manière bagay lan kay en pays ou kay hen 10 ne di temps à présent pays à présent kay vit un petit acte normal et moun kay permettre à présent commencer encore mardi, mercredi et jeudi là il vini pour 7h bon matin pour 5h après-midi. Moi kay dit ça encore là il vini pour commencer 7h au soir excusez-moi pour 5h bon matin nous ka vier à sous 10 heures de temps pour ou trouver corps en dedans. Quoi débutant 7h sous pas qu'à travailler puis service essentiel ou supposé entrer en dedans pour juste 5h bon matin. Encore naïvier répéter là il vini pour mardi, mercredi, jeudi là depuis 7h pour 5h bon matin ou supposé à trouver corps en dedans. C'est moun nan qui kay ça il fait les affaires dehors, c'est ça nous ka parler dit SI 44 et puis ça même c'est pour un monde qui travaille en service banque, c'est gens glo, c'est gens courant, gens supermarket et puis c'est moun nan qui ni ti boutique, moun qui ka bay manger, restaurant, c'est hôtel, c'est moun ça pharma. Tout ces moun ça les nous parler dit SI 44 ça c'est moun nan yo ka parler dit c'est moun ça qui permettre pour faire affaire yo mais depuis autant 7h au soir pour juste 5h bon matin ou pas supposé à sous la rue à pas dit sous ka travailler puis service essentiel là yo ka dou c'est différents côtés ça qui kay mettre en place la présence c'est jeudi samedi, là il vini pour 7h, pour 4h, c'est place ça, c'est moun ça qui trouvé koyo ka ouvert. Encore, moi ka vie répéter. Là il vini pour c'est ça nous crier SI 44, ça c'est gens courant glo, supermarket, restaurant et différents opérations comme ça. Ou kay trouvé ko c'est moun sa kay ouvert 7h bon matin pour 4h après-midi. La pays a kay fermé vendredi saint le 10 qui c'est vendredi saint et puis dimanche Pâques le 12. Là yo ka encourager yo ka dou des moun pa famille. C'est ça qui kay permettre si ou ni pour sortir dehors en communauté ou des moun pa famille. Là yo kay dou aussi premier ministre dit kay bay pli information là il vini pour ça demain si je veux mais là il vini pour pays a kay trouver koy devisé par commune et ou pas supposé quitter commune nous sous pas rien pour faire pièce côté pour aller sous pas ka travail et puis service essentiel là kay ni police là bosse supermarket là kay ni police aussi pour faire assurer moun ka rete 6 pieds hod yon a l'autre ou ni pour changer les tout partout kay ouvert et ben ces places là yo permetté pour ouvert les ça fait la kay ni police pour faire assurer moun ka payer avertissement pour ça yo jadou là qui c'est nous ni pour été 6 pieds hod yon à l'autre encore la pa kay ni pièce wom ka vend pièce côté ni en boutique ni en supermarket pièce wom kay vend pièce côté yo ka do encore nous voulons tout le monde savent, lundi c'est un jour pour ces différentes places là, mettez bagay sous l'établi yo, fait assurer yo de manger, fait assurer l'an bagay pour vous parce que les places là ouvert la kay manger. Mazé Nicole McDonald te parlé ba ici moi qui m'a dit qui ça il te vle c'est moun nan savent et quand parmi bagay il parlait c'est qu'on place là kay ouvert. Nous voulons moun changer vers maintenant là toujours, nous voulons moun changer tout bagay pour qu'on sauve. Quoi, là vini pour moun quand entrer en dedans business, yo vle place business, mettez bagay en place. Dehors quand une ligne pour assurer là entrer et ben là du bout dehors ou du bout 6 pieds hord en moun. Encore c'est des fois moun ça kay fait assurer, c'est pas tout moun en nik bou entrer dans ces places là. Yo kay quitter un petit tak moun entrer et ben yo kay quitter 5 10 yo kay do combien moun kan entrer et chaque fois ba on ti chance pour ou entrer parce que yo vle moun ou était 6 pieds hors dans l'autre yo pas vle tout moun en pagal. Là vini pour moun qui kan entrer place business nous kay vle savoir aussi moun supposé mettre un masque et puis yo supposé faire assurer la main yo bien nettoyer, bien laver et ben sous pas laver, faire assurer ça nous crie en anglais SANITIZER ou servir à sous la main. Là aussi responsabilité à kay en les places business pour faire assurer moun du bout hod yon à l'autre et qui ni pour 6 pieds. Nous ka encore pour dire en l'autre bagay moun ni pour changer ou peut pas aller en gain yon whole case tuna et ben gain yon whole case sardine là ni se bagay là combien ou ça point et là dans liste se bagay ça ou kay savent ça ou passant ni gain passer gain pli passer yon bagay yo kay fait assurer ça en place. L'autre bagay qui kay point coup là vini pour moun qui ka distribuer by communauté ou un pays c'est moun ça kay fait assurer ou renasser manger en toute boutique tout partout yo ka encourager moun qui ça gain et ça fait affaire yo avec business à sous computer et ben ça nous garder online yo ka encourager moun pour faire ça si là ni moun ka délivrer yo ka encourager pour servir ça yo ka dou encore là vini pour moun qui kay aller faire business dans la souple monsieur changer vers maintenant pour quitter nous vers maintenant pour nous pour hen oui mettre bouli quoi on y pour traiter tout le monde comme si dit ouais yoni vers maintenant là yo ka encourager moun si moi parler à sous encouragement yo ka bay différents places business pour faire assurer yo nettoyer place là et puis aussi là il vini pour manger qui a trouvé quoi il prépare en ces places ça yo ka ve pour 10 moun faire assurer yo pas ni en chay ça ka point coup parce que là yo vle tout monde ou était sauve encore commission bien clair yo ka dou yon ou était kayou ou pas supposé d'avoir là a pas dit Léa qui bay là ou était hord en chay moun et be ka vin ensemble yo si moi fait nous changer ça ou était 6 pieds hord yon à l'autre et pas oublier laver la main pas oublier pas toucher yo néon bouchou couvert bouchou là ou ka tousser et ben sou kay estionner fait en dans manière côté ou pas fait ou peut faire en dans chemise et ben en coute bois fait assurer en masse là ou ka aller dehors en public et changer curfew les ayo ba ou pour entrer en dedans sous besoin pièce information encore ligne là 3 yon ou peut couiller à sous ça n'a touché un petit akaso ça premier ministre là teni pour dire il commençait par li ka sépaté kamande nous pour sépater puis famille Smith hod Swazey ou kay savent Smith Saltibis, oui, Saltibis, et puis là, où il y a un jeune homme, 10 ans, perd la vie, quoi, premier ministre, sympathie, puis famille, et puis là, il vient pour situation là. Parmi les questions qui demandé du premier ministre, qui ça, qui te bail besoin, qui manière il fait pour une décision ça, pour ouvrir mardi, parce que nous devons expecter c'est lundi et puis dit là à sous conseil qui bail par 6 mois et après yo examiner manière bagay là yo fait décision ça yon dans ces bagay là dit qui est fait là ils savent c'est cas nous ni 14 cas et 6 mois bien bail explanation date qui yo ni tout bagay yo ka contrôler tout bail en ordre à présent mais il dit si ça pas été fait peut-être nous te kay ni pli moun parce que yon nan se bay lan qui fait lan c'est après yo hen yon moun qui ni 20 maintenant yo ni pour essayer côté moun ça passer kon moun il était en contacté puis avec ver si pièce c'est moun ça te ni 20 maintenant et puis là ou kay savent ça c'est yon nan se raison pays a te trouvé koy en bas en 24 nédican soukou là Premier ministre là les pli en détail pour dire il veut moun changer. Là il vini pour ces moun nan ni mo ka bay manger ka assister et puis ti bag manger il c'est pas pour tout monde. Ou ka savent là ni moun qui déjà te non yo te ha asu yon liste yon manier ben l'autre. Là il vini pour ces moun nan qui ka travailler en communauté là il vini pour ces gens qui travaillent et puis gouvernement local là, ces gens qui travaillent et puis officier welfare. L'argent ni un nom moun qui infime, moun qui pauvre, l'islam déjà là. Et là te ni moun ka espérer. Quoi nous voulons moun comprendre, c'est pas pour tout monde Anik vini di yo brise un bag. Nous comprenons tout le monde kay brise un bagay, mais changer ni mo ka assister, c'est moun qui plus pauvre parmi nous. Quand après ministre touché à sous ça pour dire, c'est pas ni tout monde avec n'importe monde. La te jani moun a pas de liste yo te ni pou vwe bay ni mo la ni moun ki ka kriye li mo et puis la ni mo ka assister so souple yo ka dou ni patience ek changer c'est moun nan mais c'est qui plus pauvre en parmi nous. La premier ministre aussi dit la il ka une rapport demain on souhait et qui ka en plus détail là vini qui ça qui ka fait là ils ont maintenant ces pécheurs qui ça yo ni en place bayo c'est fama qui manière bagay kay travail et encore moi juste voulais nous changer messieurs ça qui kay point quoi c'est date qui demain kay ouvert et qui kay ouvert pour ces supermarkets là pour ces boutiques là pour différentes places mettez bagay là pour les pays kay trouver koy ouvert mardi mercredi et jeudi quoi nous kay trouver qu'on nous ka ouvert mardi mercredi jeudi et là ou kay trouver chance là pour faire affaire ou kay trouver une chance mais changer chance ça ou ni 7 heures ou supposé trouver commandant pour 5 heures bon matin quoi moi ka quoi là messieurs dames s'ouvre les premières informations là ou kay henni n'importe ça qui ni pour faire et puis COVID-19 ou ça crier 3 yon nimo et veiller à sur internet là à sur Facebook premier ministre là et puis GIS la kay ni information comment dit messieurs dames si nous toutes mettez yon bagay en l'idée nous qui c'est traiter tout monde ou kay ouais kon yon moun qui ni vermin ça nous kay ça combattre vermin souple zoé pas ka ho passer tête et puis c'est ça qui était discuté aujourd'hui nous ka quoi tout le monde qui participer et puis nous et nous ka quoi ou bien comprendre ça qui te dit et vous même qui fait di voix pour coûter ça qui était by commission qui by la aujourd'hui ben moi cadeau merci en chay pour vous qui écoutez nous et pour vous qui joignent et puis nous ici à sous station télévision NTN GIS et nous a dit merci en chay pour radio DBS HTS Choice TV Hits FM Wave Vent MBC Calabash TV, Radio Caribbean, Vibe Radio, Hot FM, Hot 7 TV, Rhythm FM, Blazing FM, Kiss FM, GVT, Underground TV. Nous avons dit merci pour tout le monde qui a transmis et puis nous avons donné un bon souhait. Merci encore.